I think we all talk about theory and policy, but actually people like me just want to know, what can I do? How can I protect myself, my children, my family, and so on? So I have a life-limiting condition. I've been poorly basically from birth, but I wasn't particularly poorly until my teenage years. And since then, I'm about 10 years past my expiry date, as I like to call it, my prognosis. And it's just fantastic. And that's good medical care that's achieved that. But as of someone with a life-limiting illness, I'm very highly at risk of fatal effects of something like COVID. So protecting people like me is so important. But it's hard when you're someone like me and many other families where you have to have care staff coming in and out. You can't completely isolate. You can't just manage on your own for 3 months. So what can we do in terms of people like me? For me, it's thinking about contingency planning. That's a really big thing, and that doesn't matter if you're in a higher income country with a complex care package or a lower income country with just your family around you. You need to try and think about what can we do to protect people and to have contingency plans in place. And I don't know if people heard of the case of a young man in China who his primary carers became unwell and were quarantined, and sadly he died because no one stepped in to care for him, because no one realised that there was someone else that needed care. And we as patients and families need to stand up and say, right, these are my plans, this is what I'm going to do, and share that with the medical team, share that with everyone. So there's a step-by-step guide for everyone in your family, in your community to follow if something were to become unwell. So if my mum, for example, became unwell, yes, I've got professional nurses and carers coming in and out, but that doesn't necessarily mean I will always have that care. So thinking about, can my sister step in, or would I need to go to hospital, or would there be a hospice that could take me? Thinking about all these different ways of managing a crisis, because the fact is my mum could very easily become unwell, and if she becomes unwell, there's not really much of a contingency for me. So we've had to put in place a lot of plans. So we need to identify around a person who is available for support. So if the primary carer becomes unwell, is there another family member that can be quarantined and isolated with the mother, the primary carer and the person to step in if that primary carer became unwell? What about the issue of outside carers coming in and out? So for me, all my carers and nurses have to take their temperature before they leave their homes, before they come into my home, to make sure they haven't got the virus. They have to be honest about being around anyone, not just with COVID, but with any symptoms of cough, cold, any kind of infection whatsoever. They cannot come in, they cannot do that. And as I said, I'm lucky I have my mum, but if I didn't have my mum and I lived independently, I would have to think about other ways of managing it. It's about thinking, if you employ your own care staff, is there an agency you can contract in an emergency that can provide care in the current climate and keep you safe, so that you've always got the care you need? Because people like me cannot manage on our own. We can't care for ourselves. It's also thinking about, how are you going to manage if you do become ill? You know, will you be able to stay at home? Have you got enough support around you to manage that illness? And if you go into hospital, for people like me, ward staff cannot cope with my needs at the best of times. So what can we do? Would they allow my mum to be isolated in hospital with me to manage some of my complex care needs, so that the nurses could focus on the COVID-related needs and my mum could manage all my pre-existing conditions? I don't know. And it's also thinking about accessing food and supplies. Do you have people in your community that can support you and drop stuff off at your house, go to the shop for you, go and queue? If you can't get out for yourself, we're very fortunate. Some of my home nurses have offered to go shopping and bring that with them. So if me and my mum can't go out, I mean, I won't be going out for 3 months. If my mum can't go out, there are people that can step in and give us the supplies we need. Another issue actually is, for a lot of people with life-limiting conditions, we already isolate ourselves quite a lot anyway. So this is not an unusual perspective and not an unusual situation for us, because when the winter virus is out or other viruses are around, we often have to isolate ourselves from people. I spent 5 years completely bedbound, so I know what it's like to be isolated. But it's about, trying to take care of ourselves, manage our needs. For people that are new to being isolated, making sure they just have that support, that hospices and community services just touch base with them, have virtual contact to make sure that they're okay, they're coping, there's nothing they can do. Also, having people we can turn to about the coronavirus, about COVID, to ask questions about that. So having people we can turn to at any time of the day or night to ask for advice and have support in that kind of sense.